Hey everybody, it is Kevin Henry, editor-in-chief for drbicuspid.com. Thank you so much for joining us for another episode of our podcast. Thrilled today to be joined by Dr. Christine Armenian, who is a children's dentist in the great state of California. Dr. Armenian, how are you today?
Hello from Glendale. I'm very happy to be here. I'm excited to be part of your podcast.
Well, thank you so much for being on. And before we dive into the topic today, just love for our audience to know a little bit more about you.
I am a dentist that's limited my practice to pediatrics. I've been doing this now for 23 years. My background includes dentistry and public health. So my whole purpose is to serve our community and bring access to dental care to the children of our community.
Well, let's start with some tips maybe that we can give your colleagues heading into 2026 when they're dealing with those young patients. What are some ways that you have found is best to communicate with kids and get them past any kind of fear or what they might have when they walk into the practice?
As I tell my staff, we are a mini Disneyland. It's got to feel warm. It's got to feel comfortable. It's got to be welcoming. So the way we make it work is by opening our arms, actually literally getting on our knees, giving them a hug, welcoming them, and a lot of show and tell. We gain our respect before our respect towards them before we can actually access their mouth. We become friends. We need to gain a parent's trust. And what my most important thing is to be a family-oriented dental office.
Okay.
Where a parent feels comfortable, they feel part of our family, and a child feels comfortable because they feel safe and they feel playful.
Well, let me follow up on that then. What does it take to gain a parent's trust?
Well, we are open book. We educate the parents by showing them everything and starting from our sterilization rooms at times to make sure that they know it's a very clean practice to all the way from we have parent information books for them that we actually made where we walk them through why something is important to treat, why it's not just a baby tooth, why the importance of not putting fear in children when we provide dentistry so that as an adult, they can continue being seen by the dental office. So the most important thing is gaining their trust by really being an open book, showing them everything from A to Z, rather than just telling them, well, this is what I see and this is what needs to be done. That will not work. That will not work with any parent, but it's showing them, well, this is why I see. I show them the x-rays. I show pig intraoral pictures. I explain the importance of it. I tell them why if they don't do it, what will happen. And then I also tell them the impact of providing good dental care for their children.
I'm so glad you mentioned the baby teeth side of things, because I think for so often there's so many parents that go, well, these aren't the teeth they'll have as an adult, so it's not that big of a deal. Is it harder to get past that mindset, or is that something where education really plays a key role?
The great part is that we partner up with our pediatricians. Our pediatricians, as long as they promote seeing a dentist around the age of 1, at this point, most of the parents really trust their pediatrician. The children are able to make it to our office. So when they make it to our office by age 1 and partnering with our pediatricians and having them show, okay, I really trust Dr. Christine Armenian, I take my child to them, or they know what they're doing, the parent comes already for the sense of trust. And so when we see them by the age of 1, we develop a strong relationship with them. They start to know it's Auntie Christine versus a dentist. And the parent starts to feel comfortable because by the age of 1, we're kind of just showing them oral hygiene instructions. We're just showing them how to brush. We're telling them about the importance of the baby bottle tooth decay. And by the time when they're 3, and if they do have a decay, that partnership is already formed and the child is not even scared to go through filling.
So I have to ask, how did you build that relationship with the pediatricians?
Well, I've been in the community for 23 years.
Okay.
We've had cases that have required pediatricians' help and involvement, whether it's involved in a systemic issue or a pediatrician has seen things that they need our help. We've had recently, a few-day-old child who came because they were born with a tooth. Pediatrician connected us because we had to remove the tooth so they didn't swallow it. So it's a partnership. We work together because we need each other. Like you said, we have a child, for example, who has cancer, and we work with the pediatrician to make sure that we get them in at a time when the office is quiet, it's close because their immune system is low. And so with the hand in hand working with your pediatrician, we get them through their cleanings. We get them through the workup that they need to be able to continue with chemotherapy. So we work very closely with the pediatricians to be able to allow access to this care to them.
You mentioned your team members a few minutes ago. How important is it for those team members to be as passionate about pediatric dentistry as you are?
You have to have a very patient and kind heart to work with kids, and you have to have fun. And I think the people who apply for a job with us have that personality. And when they meet our practice, they see the practice. If they're the right fit, it's going to work. And if they're not the right fit, they won't take the job because it really requires to play all day long. Literally, that's what we do. We play, 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 and we say the craziest stories to be able to get a filling done. And sometimes we're even dancing on our heads and doing cartwheels. So my team members are my support. Without them, I can't do it. And so the person who ends up being the right fit, and I'm blessed with 11 amazing employees, it works out. And they have to, it's like little Disneyland. It has to work. So
I love that. And I also love the fact that you have been involved with Colgate's Bright Smiles, Bright Futures initiative. Tell me a little bit about that, what it is and why it's important to you.
absolutely. So my little bit backing up on it, when I was getting my public health degree at Baltimore, Johns Hopkins, that year, a few children passed away because of tooth infection. And part of a project that I'm part of was to go out and see why this happened, to collect data. Why did these children die from for tooth infection? And the bottom line was access to dental care. And when I met Nina Trujillo, was my angel. She's from the Colgate, Bright Smile, Bright Future. What I realized was that if I develop a relationship with them, we can make sure that the children in our community will have access to dental care because we go out to them. We go out to them, and every year with the LA team, we get out with support of Mary Campbell and Nina. We get out and we actually provide access to dental care to 1,500 children. And what they do is amazing. We take dentistry to them. We get the kids onto the mobile van. By fun, by a little mini field trip. We teach them how to brush, how to floss. We get them to sit on a dental chair and they see that it's not something scary. So the parents who, either for financial reasons, either because of fear, either because they don't believe in dentistry for a tooth that's going to fall out, their children are getting access to it. And by getting access to it, we're bringing down the possibilities of the child passing away from tooth infection. So what I love about the Colgate Bright Smile, Bright Future is what they actually do, which is that they have hit the milestone of hitting 2 billion children globally and their families to have access to care in more than 100 countries. So they are absolutely amazing.
It's wonderful news, and it's also wonderful that you have that passion because of something that happened in Baltimore that still motivates you to this day. Do you think that we educate the public enough about, we talk about the oral systemic link all the time, but do we educate them enough about that's important for children as well?
So I have to say, we're still, to this day, I mean, daily, I would say I get 2 or 3 new children where we diagnosed more than 8 cavities. So obviously it's still occurring, right? Still the cavity is occurring. Now, pediatricians, I feel like, are doing their due diligence. From the age of 1, they start telling parents, you need to get to the dental office. Unfortunately, there's still a percentage of parents who, again, because of access, because of financial reasons, because of, I would say more it's the fear or not believing that that the child requires, or that tooth are going to change, that they don't end up, and they only end up when the child has pain. So we still have that percentage that is still happening, unfortunately. And I guess that's just going to happen. And I think if we can get more programs like the Colgate Bright Smile, Bright Future that actually go to the schools, that actually have more maybe advertisement on TV, or whether it's through social media important, that we can get more kids in so that we don't have issues with systemic problems. Tooth infection still occurs. We still get children with tooth infections, swollen faces, that we still see them that have never been to a dentist. And I do believe there are, in Los Angeles, there's a lot of resources for parents. So if a parent really wants it, there's a lot of free dental clinics, there's free dental care. But I do believe that it's more the fear or the knowledge of the importance of it. And unfortunately, that doesn't happen until the patient child has pain or a swelling.
As we look ahead to 2026, what's the best piece of advice you'd like to share with your colleagues about working with kids and making sure that they do get that care that they need?
My biggest advice is let's get these kids in. Let's develop an environment where it's warm, it's safe, it's happy. If we can get these children through dentistry without trauma, without fear, they are going to be amazing adult patients in the future. One, they're going to actually show up to your dental office as an adult because they won't have the fear or trauma as a child. Two, their teeth are going to be in good condition because of the fact that they continuously go to the dentist and see the dentist. And three, because we want to make sure our community is well provided. And I am, again, as I said, I'm so, so grateful to Colgate Bright Smile, Bright Future because of what they've done with their hitting the mark of, 2 billion children. Uh, globally and their families and in 100 different countries having provided care.
So, Dr. Armenian, if there's somebody that wants to reach out to you, learn more about how you do things, is there a website or what's the best way for them to find out more?
So they're always welcome to email me. It's Dr. Armenian at littlewonderdentistry.com. And our website is littlewonderdentistry.com also. If they need anything, any advice on care, on how to develop an environment where it's safe for a child to be treated, please give me a call and I'm happy to help.
Well, if you're listening to this on Dr. Bicuspid, all that information is going to be in the show notes. If you're reading this on Dr. Bicuspid, or watching it, I should say, then it's in the article and very easy for you to click and get in touch with Dr. Armenian. Dr. Armenian, thank you so much for your time and your expertise today. I really do appreciate it.
Thank you. Thank you for having me.
Absolutely. And thanks to all of you who've listened to this episode of the drbicuspid.com podcast. Hey, it's important to think about that next generation of dental patients as we head into 2026 and what you can do to make sure that they're not only getting the care that they deserve, but having a little bit of fun as well. Till next time, it's Kevin Henry, editor in chief, signing off. And as always, wishing you nothing but success ahead.